My name is Lisa Cobell. I'm the medical director at Minnesota Avenue. We're the second largest Unity HealthCare Center site. We're a federally qualified health center. We serve the underserved in the district without regard for their ability to pay. We have made a few changes recently due to COVID. We have a COVID tent out front that offers testing to all citizens of the District of Columbia, including children. We also offer walk-in services for people who have acute medical issues. And we have continuity care with physicians and nurse practitioners who care for pretty much every age, from newborn all the way up. I think our oldest patient is 101. And we're happy to serve them, and we're committed to the mission of Unity, which is to serve the underserved.
Thank you so much, Lisa,
for your services. Quick question: what is the current situation in the COVID patients here? You are looking in the increasing or decreasing the numbers?
Well, right now what we're seeing is at Unity, the numbers at Unity are a bit higher for COVID positive tests than in the district as a rule, mostly because our population is mostly African American and they have higher rates of infection.
So what is it now?
About 5% right now.
And in the district?
In the district, I think it's about 3% right now. But it goes up and down. In May, it was like, I don't know, like 20%. We were seeing a lot of people in May.
Go ahead. Lisa, what precautions you recommend to the community, to the patients that they should take it?
We recommend that everybody should wear a mask when they're outside of their home, not only to protect themselves, but to protect other people. We also recommend that everybody try to stay socially appropriate and 6 feet distance from other people. We recommend that people wash their hands on a really frequent basis, particularly
a nurse to patient registration, please.
Particularly after going to the bathroom or before eating. And anybody who has any symptoms, we recommend that they can call Unity and be assessed and see whether they need to have COVID testing done.
So do you have any rapid testing?
No, we don't have the rapid test yet. We expect it to be coming shortly, but our administration is trying to make sure that we get a rapid test that has good sensitivity and good specificity. And so there's so many on the market right now that we're trying to find one that we feel pretty confident in.
So on an average, how many patients do you see daily basis?
About 250 a day.
Wow, 250, good. That's a lot.
Lisa, tell us about your great staff. You have a really great diverse staff.
We try to hire a lot of our staff from within the community in order to give them jobs within the community, and that helps our patients as well. And so I would say most of our patients, most of our staff are from around here, but we have people from everywhere. Our pediatrician is from Egypt. We have physicians who are from Africa. And then we have local, and we kind of have a little bit of everything.
Lisa, Andrea and
if they are positive, what happens to them?
So if they're positive, they're notified by a nurse or by a provider, and then we assess their symptoms. We encourage them to keep their 14-day quarantine, and then we check on them at the end of the quarantine to make sure that they're doing okay, because sometimes people, even when they feel okay at the beginning with a positive test, they don't feel so well later on. So we try not to lose anybody who had a positive test.
So how long does it take to get the results?
It depends on the number of people being tested. Right now it's about 2 to 3 days. At one point it was up to 5 to 7 days in May because it was just a lot harder, because there were so many people coming in. But right now about 2 to 3 days. And we're getting better at it too. I think we're just getting smoother as we get more practice, unfortunately.
Yeah, exactly.
On behalf of Adams and our friends, Andrea Barron, we really appreciate all the services that you are providing over here in Washington, D.C. And thank you to you, and thank you, Andrea, for arranging those lunches. Would you like to say anything, Ms. Andrea?
Sure. So this is a really exciting day for us as Washington area Jews for Jewish Muslim Understanding, for the Adams Mosque, second largest mosque in the country, and also for JAMAAT, Jews, Muslims, and their allies together. This is our first joint project. Adams does community service all the time, and also I told everyone how excited it is that we have a medical director who's an Orthodox Jew, that's you, and we have 2 Muslim pediatricians, one from Egypt, one an African American, and Indian staff.
We have Indian staff as well.
And lots of African American and Latinos, and it just represents the diversity of America. So I think that, what we're trying to do and what you're trying to do and what you're doing here at Unity, we hope that's the America that we want to see.
Yeah.
Well, God willing, yes.
Yeah,
and Also, we appreciate your giving of charity and you're doing your good works for us. We certainly do appreciate it.
Thank you so much.
Thank you.
Thank you. Appreciate it.
Andrea brought a good point that we love to see the diversity, inclusiveness. We really like it, and hopefully we continue it. You see
God willing.
everywhere.
God willing, yes.
Thank you, everybody.
Inshallah.
My pleasure.